because I think there is a specific time, so they do this every 15 minutes or something like this.
Yeah.
So they wait.
Hello, we are here again doing our interviews for the ESC during the Congress in Helsinki. And today we have the pleasure to have two of the best speakers ever, Eugenio Pedula and Ghassan Jared. Both of them are fantastic, and we are going to discuss some points. And the first one is we're going to talk a little bit about final preparation. Eugenio,
Okay.
what do you think about this final preparation? How we're going to manage everything? What is related about the size of the file, the conicity?
Okay. Okay.
Tell me something about it.
Thank you, Ruth. It's a big pleasure to have the chance to discuss in a friendly way with you and with Ghassan about this. It's really important that the final preparation is performed properly because, as usual, it's important. The most important aim during our endodontic treatment is related to the bacteria disinfection. That obviously we can achieve with the irrigants, but we need also some mechanical debridement. Not because it is needed, even because we know perfectly that instrumentation alone is not able to touch the 100% of the walls. But it is needed at least since now, also for the irrigants to achieve the spaces of the complexity of the root canal system. So basically, I think that we should have always an attention, maybe a specific time to finish our preparation, and I think that even today, at least for the technique that we have, even if for sure Ghassan can say something more about this, we can arrive at 30 minimum sometimes, but obviously in sometimes even 40 or 50, depends on the clinical case. But okay, probably it's possible to achieve also a good disinfection with also smaller preparation, but for sure using some devices for the activation of the irrigant. So I do not exclude that maybe we can reduce the preparation even to 20, but probably more you decrease the preparation, more you have to maybe push a little bit or increase the time or the action of the irrigants. And also I think that is really important to speak about final preparation, so not just the tip sites, because tip is just the end, not just at the end of the root canal, but maybe also the taper. It does not sense, in my opinion, to speak about I finish at 30 or 20, but okay, which taper? 2008, 2002, because normally, okay, the last part, the last millimeter is the most important one, but normally it's important all at least the last 3 millimeters. So it's really important that maybe we have to speak, because I expect that maybe we can have in general more tip sites, but absolutely less taper in a more conservative way, and also irrigants will help us.
Thank you so much.
Thank you.
What's your opinion, Dr. Jared?
Thank Ruth for having me here with Eugenio and yourself. How did you know about non-instrumentation? Did I tell you about it?
I don't know.
Yeah.
Maybe someone have told me something, and you know I'm a little bit gossip for these things, and I knew something. So let me know.
So definitely I want to have a non-instrumentation technique, and this is what I'm currently working on. Size of preparation, tape of preparation for me do not matter. Of course, what matters, like Eugenio said, is the elimination of infection. And for me, most likely the best way to be able to eliminate the infection is first not to create debris and not to create smear layer. By avoiding debris and by avoiding smear layer, the irrigants will be much more effective in killing bacteria, especially if we use sodium hypochlorite that we heat in the canal. The literature about the action of heated sodium hypochlorite is exhaustive, and it has existed since the 1930s. And I'm very surprised that so far the the potential of heating sodium hypochlorite has not been exploited. And this is what I'm working on right now. Actually, right now, large canals, I do not instrument them at all. And this should not be surprising.
But when you say...
If you think about the pulp regeneration techniques, we do not instrument. So it is, in a way, a similar rationale. At the end, we will have some limitations for non-instrumentation. So the way I see things, and this is what I'm working for, is to have really a small instrument used just to create a space for an instrument that can heat and activate the sodium hypochlorite in the canal.
Till the working length.
To the working length, with minimal debris formation and smear layer formation.
I understand. So you're planning something, really?
Yes.
Something is in your mind,
yes.
And it's going on.
It's
and
going on,
And
yes.
it's still something that we should not know absolutely everything, right?
Correct, correct.
Okay, so what do you think about that?
I totally agree with Ghassan. In an ideal world, this could be really perfect. We can avoid a lot of difficulties that we have with the shapings. But honestly, today, at least today, we have some limitation, but obviously research could help to overpass these problems, because the big limitations are that we use already sodium hypochlorite. And sodium hypochlorite has a very high surface tension, so as Ghassan said, it's good, but we have to put this in the at the working length, so in the apical fair. It is not able to go there by itself. So a minimal instrumentation, at least today, I think it is absolutely mandatory. And maybe very little, as I told you, as much you activate your irrigation or have a sophisticated device, as much you can reduce your preparation. Maybe you can do just the glide path, like 1504, 1503, maybe even 03. But the problem is, for me, it's related to also the irrigant that we have and the needed that we have actually to put the sodium hypochlorite in the apical part, also thanks to the instruments, not only about the shaping that we have. And also there is the other problem in this ideal world, in which that could be very nice, that is the obturation after. So I don't know, honestly, always today, but nice that we work on this, if we have enough devices or maybe materials that could be good to have an obturation with a so tiny, so thin preparation like 1503 or something like this. But I'm sure materials develop a lot, so why not? Could be a very interesting research on this.
And last question to both of you. Till that happened and Dr. Jared developed completely all this protocol, till that happens,
Yes.
what is your favorite instrumentation technique for both of you? Which one is your favorite preparation way, rotary, reciprocating? What do you like?
Start you, Ghassan.
Well, obviously, everyone knows that reciproc, not any reciprocation, reciproc, blue, to be very clear. It's safe, it's very safe, it's very efficient, but mainly it is probably one of the only systems which is backed up with very strong evidence. More than 400 articles published on reciproc alone. And this hasn't been done for any other system so far. And if I may just go back to what we were talking about the obturation of minimally instrumented canals or non-instrumented canals, there is a way which I'm already doing for at least the medium size or the large canals. So it can be obturated very easily. But even for canals where which we instrument with a size 1502, where I would use a device to heat and sonicate the ultrasonic, there is also a way to obturate them. It is in here. I just need time to make it happen, and it will happen.
I mean, you are an inventor. That's the thing, right? Yes, yes. And you? What do
I,
you prefer?
I like also the vision of Gassan is always farther. For me, actually, my favorite preparation is at least today in continuous rotation, or maybe even some hybrid motion like the Jenny motion, that it is a mix of, and it's an automatic motion in which there is a change by the algorithm of the machine between continuous rotation and different kind of reciprocation, but nothing to set, already done by by the motor disc. So this could be a good way, and for sure it's simplify and it becomes a little bit faster. So as we need the preparation, we need kinematics, but also I agree with Gassan, not only reciprocation, in this case, not only Jenny motion, but also the right instruments, because the good shaping and especially the good feeling of your shaping, during the shaping, it's always a connection and a mix of the efficiency of the instrument and the efficiency also of the kinematics.
Amazing answers, guys. So thank you both for being here with me with the ESC interviews, and
Thank you to you, Ruth.
I appreciate it a lot. Thank you so
The
much.
best moderator I am.
I don't know.
Thank
Thank
you.
you.
Thank you to you and thank